World Health Organization has brought together some of the leading minds in the health field to talk about tackling the Ebola epidemic. So what should we expect from the meeting in Geneva? I asked Kathryn Jacobsen. She spent a career studying outbreaks like Ebola and even has experience in West Africa.
The focus of this week's summit in Geneva is on the technology for the Ebola containment. So they're focusing on medications and also on vaccines. And at this point, we don't have any vaccine that's been proven to be effective. We also have no treatment that's been proven to be effective. If we are able to get some of the candidate vaccines or the ZMapp into the production pipeline and show that it is effective for Ebola, it will still be months and probably a year or more before they're widely available.
And ZMapp still looks like the silver bullet to the media. The most recent report about these monkeys that were infected, and I think it was 100% effective against them. Is it the silver bullet, or is it too early to tell?
It's much too early to tell if ZMapp is actually effective. So right now there are roughly 7 humans who have had the treatment. I think 2 of them died, and I think several have survived. But that's still a fairly high case fatality rate, so it's not something that's effective for every case. So as ZMapp is tested more in humans, we'll be looking to see what is the appropriate dosage, what stage of the infection is the time when it works most effectively. So do people need to receive it early in the infection for it to work? Is it something that you can wait until people are really in bad shape and use it at that time? Those are questions we don't have answers to yet. And part of what the summit this week will be looking at is how do we put studies in place to examine the safety, the dosage, and the efficacy of ZMapp.
The head of the CDC in Atlanta also saying that the window is closing. The global response needs to happen, and it needs to happen now. Has the global community been too slow to react?
It's hard to say, looking forward from a point in time, what's necessary. It's always easy to look back in time and say, if only we had been able to intervene in a slightly different way. We have seen that in Nigeria, the public health system has, for the most part, worked to keep that outbreak from getting significantly worse. But we have seen that in some of the more affected areas, the outbreak continues to spread. So there is a call from the governments of Sierra Leone, Liberia, and Guinea for more outside support. And I hope that our national, international partners will be responsive to that call.
We've heard a lot of horror stories, and I'm sure you've heard them as well. And yet, in many respects, if there's anybody who understands the climate, I mean, you've worked in Sierra Leone, you've been in Bo, there have been cases there, you're in contact with people. Is the media portrayal on target? Can you give us an idea of what you're hearing from your people on the ground there in terms of the level of fear and concern, and also the response?
For people who live in the affected countries, Ebola is very much the most important thing that they're thinking about a lot of the time. They are seeing friends and family get sick. They're seeing people who are dying from this. And they're also seeing quarantines being set up to try to restrict travel. They're seeing that hospitals, in some cases, are shutting down because doctors and nurses have said, we don't have the equipment we need to stay safe. And if we can't protect ourselves, we can't care for patients. So for people who live in affected areas, Ebola is a huge part of their daily lives. For those of us who don't live in affected areas, it's a little difficult potentially to understand just how much this real fear in West Africa is affecting daily routines.
I think people don't recognize just how difficult this is for the medical community. I was reading where these doctors are working just enormous shifts, but they're in this protective gear, and the heat is so intense, and that the sweat's going into their goggles, it's difficult to even see, and just this type of labor is just so difficult. I mean, give us an idea of the degree of difficulty for healthcare workers and what they're up against.
The healthcare workers are not just facing limitations with having access to supplies. Even if they do, they don't have access to the colleagues that they need. So it's really long shifts, a lot of patient care, and it's really emotional work to be working with people who are so sick and who have such a high case fatality rate. So we do need some more people on the ground who are medically trained who can go in and provide relief for the folks who have been working so hard and so diligently for so many months now to try to contain this outbreak.
All right, Kathryn, thanks so much.
Thank you.